place the heel of my palm. So that will just, as we have the heel of our foot, this is the heel of our palm. So only the heel of the palm would be there, and I will intertwine my other fingers there. The fingers remain away from the chest, only this portion would be on the sternum, and I lock my elbows, come over the center of the victim. My wrist, my elbow and my shoulder are in one line, so that when I'm giving CPR, the pressure is from my back and hips. It is the body weight which is pressing it. I do not unlock my knees, else I will be dissipating the pressure. And I press 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. For how long?
15.
Anybody?
30:2.
30:2. Very good. So I give 30 compressions, and after that I give 2 breaths.
Dr. Udupi, why did we stop the kiss of life?
Why did we stop the?
And when we grew up, CPR used to be
Yes.
4 pumps and one
Yes,
nostril.
I'll tell you why.
Why did we stop?
Why one breath, right? Why? Because adults are not dying because of breathing issues. They are dying because of that pump which has stopped. Because of that
But you're
electric
giving
current.
some oxygen when you're breathing in.
So now the guidelines which say 30 compressions and 2 breaths. The 2 breaths that you're giving, they are very much adequate. The oxygen that we're giving is very much adequate for the oxygen to be supplied to every organ. What is important here is a high quality CPR, high quality chest compressions, which is the mainstay. In fact, I would say, sir, this is the patient who had come. You don't even know him. Probably you don't want to give him a mouth-to-mouth respiration. You probably don't have a pocket mask in your OPD. You don't have a bag mask. It's probably a roadside accident. Would you like to give him mouth-to-mouth? No. So now the guidelines say forget about respiration. Just give him chest compressions. Just give chest compressions at the rate of 100 to 120 per minute. That's approximately 2 chest compressions in 1 second. So that's the rate you give it at. That is the speed. 1, 2, 3, 4, 5, 6. So this is the rate you're giving it at. And there has to be a depth. You push hard. Push hard means you depth of at least 5 centimeters in an adult. At least 5 centimeters in an adult, not more than 6 centimeters. Now you can ask me that how would we know this is 5 centimeters? So that comes with practice. Certainly comes with practice, what we do on mannequins and what we offer in our courses. When you do VLS courses, when you keep on refreshing your knowledge, you keep on practicing, you know how much is 5 centimeters, how much is a good chest compression. So push hard is at least 5 centimeters, push fast. Push fast means the rate is 100 to 120 per minute. That is almost 2 compressions in 1 second. And then you allow for a maximum recoil. It's like a water tank, okay? The water tank filled with blood, the heart. You have pumped in, but you need to pump out so that the blood can refill into the heart so that you can push it out again. So you have to allow for a recoil, a chest recoil, and minimize interruptions.
So this is just working as in a mechanical manner. Electrophysiologically, it's not activating the heart in any manner.
It cannot. For that, I have called the ambulance, sir. For that, I have called
This is just a pump
the
that is working.
This is what I'm doing till the time the defibrillator comes.
So faster is better.
If I do it very fast,
More can do more.
if I'm just pushing it very fast, how do I refill it?
But twice in a second isn't that super fast?
It's not super fast. It's absolutely fine. It's a rate of 120 per minute.
AHA moved from 4 to 16 to 30.
Yes, sir. It has
Because,
become 30s to 2 because adults are dying because of that electrical locha. Adults are dying because of that ventricular fibrillation. They need defibrillation ASAP. They're not dying because of lack of oxygen. If I'm taking in air, that's atmospheric air is 21% oxygen. What I'm giving in mouth to mouth is I'm using up my oxygen and giving him my exhaled air. That's 16 to 17%. Even that is good enough for him to survive. But he needs a pump. What will he do of oxygen in the lungs when it is not pumping to the brain, not pumping to the
The
organs?
concept is also that if the airway is open, your chest compression is also going to cause a certain amount of
Expiration, right?
Yeah, respiratory.
Inspiration
Yes,
expiration.
but then again in 2015, the entire guideline changed from ABC to CAB.
CAB.
Now it is
Circulation.
CAB. That is why I have been telling you compressions first. If you don't know how to give breaths, you don't want to give breaths, don't give breaths. Just give compressions. These are the latest guidelines.
For an ENT surgeon, it is important to have the airway clear.
Absolutely,
Most
absolutely.
of them would be having bleeding in the oropharyngeal or in the airway. So you
Absolutely,
would probably
absolutely.
like to evacuate.
Absolutely. If you know the cause,
Yeah.
if you know it's a foreign body aspiration, it's because of which.
We talk